Broadcasting from Silicon Valley, California, this is Conversations with Jennylyn.
Thank you for watching Conversations with Jennylyn. Today I have another fascinating guest to share with us. And this time we are in Ireland with Dr. Patrick Treacy, and he's the owner of Ailesbury Clinics in Ireland. Doctor, I know how busy you are, and I'm very grateful that you can afford this time to spend with me and my viewers. Welcome to Conversations with Jennylyn.
Hi, Jennylyn.
So you are the owner of, am I pronouncing the name of your clinics correctly, Ailesbury?
Yes.
And how many clinics do you have?
Well, we have a lot less now than we did 10 years ago.
Okay.
We were one of the first aesthetic clinics in the world, you know. Aesthetic medicine really came together when three other things came together. And that was, I suppose, the use of Botox in an aesthetic rather than medical sense. And that happened about 1996. The first fillers that were hyaluronic acid happened in 1996 as well. And then IPL technology for lasers, making them simple, happened around the same time. So for the first time in that period, we had patients who could afford cosmetic work, who didn't have to get cosmetic surgery. So most of the clinics started around 1998. And in the first couple of years, we had a lot of patients coming from the United States, because the United States were using collagen. They weren't using hyaluronic acid, which was much safer and lasts much longer. It could last up to 4 times longer. But the reason the United States fell behind in that was because of FDA holding it up for 7 years. So we had it from 1996, and the United States introduced it in 2005. I only mention that because of 2 reasons. The first thing is all our Dublin clinics were full of patients from New York, San Francisco, and all the rest, for the people who, you know, were aware that this was a superior product. And the second thing, when problems started to happen in the United States, we had the technical experience to solve them out. For instance, in 2005, Michael Jackson got too much fillers in his face. I'm sure I can say that now. He's dead a long time, and it sort of is well, I suppose, documented. So Arnie Klein had set them over Dublin so we could remove some. But there are very few places in the world, not just with us in Dublin, able to remove it. And it was only in later years, when everybody started doing a lot of aesthetic work and they started injecting arteries and having a lot of vascular occlusions, that the use of the reversal agent for hyaluronic acid became very popular. Now, everybody can use it, but in that period, which is 15 years ago, it's not unfair to say that Michael was one of the first people in the world to get hyaluronic to take out some of his fillers. I'll tell you a funny story. Michael had body dysmorphia, obviously. I'm sure that's no secret either. And he thought he had a little bit too much fillers in one side, so he wanted it removed, and he was willing to fly across the Atlantic to do that. Now, the thing is that Michael was invited to the opening of Casino Royale, and the Queen was going to meet him. So he wanted to look his best for the Queen, which is the reason he wanted this little bit out. It was so small, like, you know, I mean, in a face, you put a mil, maybe. A spoonful, a teaspoon is 5 mil. So he wanted like 1/10 of 1 mil, which is 100 of a teaspoon removed, which is fair enough. And that's his prerogative. But when he went to London to meet the Queen, he bottled out. And he stayed in, I think it was Claridge's Hotel, and he didn't meet her at all in the end because he just was a bit shy, you know.
Isn't that something? That's a great piece of history there. Well, you know, you and I have something in common, because I used to co-own a medical cosmetic clinic where we used a lot of those fillers and the Botox. We did everything except the surgeries. So it's an honor for me to meet with you, knowing that you were the person who started this. I did not know that when I asked you to do this interview.
That's interesting. Yeah, I'd be recognized, I suppose, as one of the first people who started the field of aesthetic medicine. And in Las Vegas, only a few months ago, I won top aesthetic physician in the world, which is interesting.
Wow.
So that was a double honor. And at the moment, I'm writing an interesting book on the history of aesthetic medicine. And I'll probably get back to that tonight. So yeah, it's, I suppose, something to look back on, really. I mean, there's a lot of interesting things I've done in my life. I was a prisoner to Saddam Hussein for a period. During the period that Saddam was there,
Yeah.
I was on the Berlin Wall when it came down.
Wow.
I grew up in Northern Ireland in the middle of all the troubles, the war. And yeah, so there's a lot of interesting things. I wrote a memoir about 5 years ago that was a bestseller at the time, but that and other stories, you know, sort of. As you get older, you have more stories. I think that's what happens.
Of course.
You know,
As
yeah.
you live life, you have more to add to whatever you've written. Where would I find your memoir?
Bit difficult now. You probably still find it on Amazon.
Okay.
It's called Behind the Mask by Patrick Treacy. And of course, Behind the Mask is the surgical mask,
Yes.
which is the story behind the doctor, the surgeon.
Yes.
And it's also, of course, one of Michael Jackson's songs, you know. So I've updated that memoir recently, and it's going to be released this year. And I used another singer, not that I treated the singer, but I sing his songs on guitar, and that was Neil Young. So because I came up with the techniques to reverse dermal filler injuries, I'm going to call this one the needle and the damage done. So that's
Wow.
yeah.
I feel really privileged to be doing this interview with you because that is my forte. This, interviewing people, producing television, and the beauty cosmetic industry are my two passions. So isn't that something? I did not know that before this moment. I'd be very interested in that book when you're through with it.
It's updated. The last book I wrote, the memoir, which didn't really go into anything except setting up aesthetic medicine, didn't go into any of the awards I got, anything like this here, but it was up to 2012 and was published in 2015. And it was in the recession, and the book sold out very quickly. But the publishers, unfortunately, got caught in the recession, and they sort of had gone a bit belly up. And the new publishers took it on, so we've updated the book from 2012 to 2020, and a lot of my research into the awards I had recently for aesthetic research are in the new book, you know? Yeah.
Well, that is wonderful. It sounds like you are a multi-talented person, and I just love people.
Can you hear that bird in the background? I have a bird that arrived on my balcony, which is sort of here, but it's after leaving now. Yeah.
You still have your Christmas tree up? Good.
Yes, I decided to do that. You know, I decided, that's funny because a friend of mine got it for me. And
Yeah.
I actually, if you look at it, it's different. I cut it down to half size.
Yes.
And I just use it as a decoration.
Yeah, you know, we not have Christmas all year. I agree with you. There's some parts of my Christmas decorations I don't remove either.
Yeah, the other half of it is sitting out on the balcony, but I actually quite liked it. So when I go to bed at night time, I just leave it on in the house. And
yes.
It's more as a nice little, it's only 1/3 the size it was when I got it, you know?
Yes.
So, yeah, that's so funny. Everybody says that because they tend to see it during the webinars, but
oh, they
I'm
are.
not embarrassed by it. It's more just a novelty, you know?
You can always say I'm a busy doctor. I don't have time to dismantle it.
So there's more joy comes from it that doesn't. So on balance,
Good.
in terms of the karma from it, I'll leave it alone.
Good for you. So I'm very interested, now that I know that you and I have a thing in common. How do you feel about fillers today? Is that still your preference when it comes to replenishing loss in the face?
You know, fillers really are like a paintbrush. And the people who get the best results are the people who will always get the best results. They're almost like the artists, the left-handed, the sculptors, you know. Now, some companies, particularly a big one down the road from you, that were in Irvine, California, sell a lot of fillers. And what they do is they just teach almost like fillers by numbers, but a certain amount here, a certain amount here. And, you know, that's fine. Some good colleagues of mine, Maurizio De Maio and that, have shown them where to inject little, you know, sort of dots into the face. And that's against everything I know on aesthetic medicine. But having said that, it sells a lot of fillers to clinics, to people who aren't that talented, who it's almost like drawing by numbers, you know?
Yeah.
So for us older and maybe more experienced practitioners, we would tend to say everybody's different. Some people are asymmetrical, some people aren't. You can't apply the same formula to everybody. But to be fair, it works. And some of these people, the company tells them that they're brilliant because they get great results. And really, I wouldn't say they're brilliant. If you give them a problem and say, okay, go and deal with that, they'd have to use this, you know, sort of dot, 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 dot. So because of that, I get a lot of complex problems, you know, people who would have cancer, people that would have HIV lipodystrophy in the early ages. We don't see it as much now. People with congenital lipodystrophy. And you feel like saying to someone, okay, you go and fix that now, you know, your little dots won't work, you know. So because we're doing, you know, more complex things, you have to know the way into the face.
Yeah.
Because, you know, the infraorbital artery nerve is here, the transfacial artery is here, the alar and the ordinary facial artery comes up here. And it's so easy, if you don't know your anatomy, to cause a lot of problems in people. And even if you do know your anatomy, you don't know that your patient may have a different type of anatomy. And unfortunately, what we read in the textbooks is not the way people are. The first thing is anatomy is three-dimensional, not two-dimensional. So you don't know what depth the blood vessel is. The second thing is the diagrams where, you know, the arteries run all the way up. They only do that in about 30 to 40% of people. Some of them end here and they get new arteries coming in from the side. So, you know, no two people are the same. And because of that, we have very lax legislation in the United Kingdom. It's almost as bad in Ireland because they follow what the United Kingdom does. And we have beauticians injecting, we have people who are non-medical injecting, lay people, you know, and this has given rise to a horrendous amount of problems. And I don't know why the governments don't want to address it, you know. And because of that, I tend to deal with a lot of these problems, but I'm never critical. You know, if a beautician comes into me and says, look, you know, you got to take the problem almost like you're in accident and emergency or an ER room. So if a person came in who had raped somebody, you still have to treat them, you know, that's your function as a doctor. And if somebody has got their face destroyed by a beautician, you can't really say that. You know, you may take them to one side, not in front of the patient and say, you know, you shouldn't really be injecting. But unfortunately, particularly in England, not so much in Scotland or Ireland, particularly in England, it really is out of control. Everybody's injecting everything from lips to faces, and it's going that way in the United States as well, believe it or not. I have a lot of my colleagues, and I sit on some committees in Paris that some of my American colleagues sit with me, and they tell me that there's a lot of clinics as well that are doing this. There seems to be a particular wave coming from Eastern Europe, Polish, Lithuanian, Ukrainian, not so much Ukrainian actually, but Latvia, and they seem to be flooding all the clinics, you know, and doing this. I think in that period that the Soviet Union left and Europe really hadn't taken control, it became like a bit of a Wild West in a lot of those, you know, sort of Eastern European countries. And as their economies crashed and tanked, they came to Ireland and England and just feel that they're entitled to do this just because they did it in Poland or in Lithuania, or, you know.
Well, I know that a lot of people can get their hands on the products now, because in the past, when I had my clinic, we only got the products through the reps for the various lines.
Oh, you can get them on the internet now.
Yes, people buy them on the internet, and I think random people are just buying them and injecting, like you say.
And not only that, but there's a lot of Chinese copies out there that look exactly the same. I've seen them. They don't have a hologram. And so even if the patients are signing a consent form for Galderma or Allergan or Teoxane or whatever, you don't know that's what they got, you know?
Yeah,
Unless you're going to a reputable clinic. When you see some of these clinics with, you know, 1 mil of filler for $150, you say, how can they do that? It's costing me that to buy it. You know,
yeah.
so you know immediately that there's something, you
Yeah.
know,
It's
fishy
not
going
the
on.
real deal, yes. Two things. Does the filler move? Like if you inject it in the cheek, does it move in that area? Because I know someone that had that happen.
Okay, well, there's three things. There's one company that have a lot of problems with the cover it up. And certainly, I don't know whether you get product migration or you get a type 4 hypersensitivity reaction, but they do get problems elsewhere. I don't want to sort of mention the company, but it's well known in the business. The second thing is, whatever age you're doing it at, if you're sort of around perimenopause, in the period, I suppose, your late 40s to mid 50s, you get a thing called malar fat pad descent. And as a consequence, the filler tends to move with it. But in general, fillers don't move. You know, if they're correctly positioned with the right product, normally they stay in the one position, you know. But it's a good point from the point of view that a lot of people tend to go for fillers that last a long time, whether they're semi-permanent. Don't do that. Because if they move, then you're buggered. How do you get them back out? Whereas the other ones, at least you know if they move, we'll wait 6 months and it'll be back to normal.
Yeah. So I have been a guest of one of the top plastic surgeons in China, Dr. Yu Li, and he is a doctor who doesn't believe in fillers, and he has been really restoring a youthful appearance on many. He's done 6,000 women, and he invited me to go to China.
And what does he use? Fat or?
He's using fat. And I was privileged to be in his operating room twice, where he removes fat from the thigh, centrifuges it, and then separates the globules, and he uses the smaller globules for the orbital canal and the larger globules in the nasal labia folds. How do you feel about using only fat for replenishing loss?
Sure. I think it's wonderful. That's the first thing. The second thing is that it's a technique that the more you do, the more you can experience how to do it.
Yes.
It has some problems, if not many problems. The first thing is, if you're not using stem cell associated fat, then 25% of the take disappears because it can't form its own blood cells. So to counteract that, you have to either repeat it in a month with 25% more, or you have to put in 25% extra in the beginning. Now, whenever you use stem cells, the fat has a take of 87%, so only 13% disappears. It can be dangerous, particularly around the eye area, and it has known to have caused blindness in that area. Then that's the bad things. The good things, of course, are number one, is your own fat. Number two, it's going to last for a long, long time, whereas fillers will wear off. And number three, in the hands of an experienced autologous fat transfer surgeon, you can get really wonderful results. And I think in many ways it's better than fillers, but like most things in life, it needs an experienced person to do it, you know?
He is one of the experts because he has patented his own instrument.
Yes, I met him in Shanghai, I think.
Oh, you met him? Yes.
Yeah, I think we lectured together at a congress. Yeah,
he's very good. I've seen his work and I'm very impressed with it. Well,
yes.
I think I agree with you, but how do you feel about using that for the breast? Because some women,
Yeah, I used to do it myself, and now I send some of my um, patients to London. Well, 78% of breasts are fat anyway. So, I mean, it makes sense, I mean, we did use hyaluronic acid in breasts um, called macrolane,
yeah,
and QMed made it, and 3% gave capsulization. There was a certain percentage of infection, which shouldn't happen. But with fat transfer, I've seen some infections also, nasty old abscesses.
yeah,
Um, two from the one clinic I had to deal with. But fat transfer to breast is also dependent on your age and whether you're drooping or not. So if you can take your breast and put a pencil underneath it and it stays there, then you probably need maxilloplexy or breast lift as well as augmentation. Um, there's not too much difference, I suppose, in terms of fat and fillers for breasts. From the
okay.
point of view, they're almost the same viscosity, they almost give the same amount of volumization. Neither of them are great lifters, if you know what I mean.
Yeah,
So if you're 40 and above and your Cooper's ligaments have dropped, you may need your breast tightened up a little bit. But if you just have small breasts with, say, a B cup and you want to make it to a D, I think that fat is fine. And in fact, fat is probably much safer than having all
okay.
the problems we've had with, like PIP implants and capsulization and yeah.
So you don't buy into the belief that the body breaks the fat down and it's just a temporary quick fix, because that's what some
The
people
body
think.
doesn't really break the fat down. What happens is something slightly different. Fat needs a big blood supply. It's
Okay.
almost like an arterial highway,
Yes.
and because it's the storage of energy in the body, you've got to see it as almost like the arterial, shouldn't like the highway, and to an extent, because it needs a good blood supply. When you transfer it, it all doesn't take a blood supply, so a certain amount of it becomes necrotic and dies off. So it's not so much that the body breaks it down. Um, what happens normally is it just doesn't take. But if you have a certain amount after 6 weeks, most of it stays there. But
Okay.
the bit that disappears in the beginning isn't because of enzymatic reaction. It's mostly because of blood supply.
Well, you are a wealth of information. We have to do another interview.
No problem. Yeah.
We'll be staying in touch because I'm already having some ideas flying through my head that I would like to do with you. Do you ever come to San Francisco?
I used to live in Santa Barbara.
Oh, you did. You lived in Santa Barbara. And you
Mm,
prefer living in Ireland?
not really, but when I came back to Ireland, it had a big boom time and then it had a crash. So we're all caught here now paying off debt, that we'll be paying till we're 70, because our properties dropped from worth about 8 million to maybe about 3 to 2 million, or about 7 to 2. So, I mean, we still have to pay back the 5 million on the properties. So
Oh, that's the risk you take with the real estate market, isn't it?
that's a risk you take with the real estate market. I agree totally, absolutely. And the biggest property crash anywhere in the world was in Ireland. I
Really?
mean,
Why is that?
why?
Yeah.
When? 2010, 2007. Yeah, Ireland's property crash was nearly twice worse than the Wall Street crash.
Wow, I was not aware of that.
Okay, let me give you an example. How many people live in the United States?
I don't even want to guess. I know a lot. I would imagine close to 1 billion.
No, not close to a billion. No, no.
Okay.
Not even close to a third of a billion.
Oh,
You've about a 350 million, maybe with undocumented people possibly getting up towards 4, but about 350 billion. Okay.
okay.
How many people live in Ireland?
I would imagine not even 2 million. Because it's
No, 4 million.
4 million. Okay.
Okay. America, even though it caused the world crash with Fannie Mae and with all that Bershan agreement where, you know, they gave these people mortgages they should never have, and they packaged them up in Dublin and London and sent them back, blah, blah, blah. We all know the background to it. Okay. How much did America lose? How much did Obama have to put into the economy to prop it up?
Not as much as clearly as you've had to put in Ireland.
No, he put in 860 billion, okay?
I wasn't aware, I wasn't paying attention to that. So this is good for me.
Okay, well, listen now for one moment. America has nearly 400 million people and they needed 860 billion. Ireland has 100 the size, okay? 4 million, and they needed 230 billion, okay? That's the difference. They didn't need like 100 of the 860, which is like, you know, yeah. So Ireland's property crash was an economy crash, was the biggest anywhere in the world ever. They don't think anything will ever come close to it, you know. I had 5 patients commit suicide, my top patients.
Oh, no.
They're all millionaires,
So
yeah.
sorry. And I would imagine with this pandemic, it's not helping.
Exactly. We're just coming out of one thing and going into the other. Yes, there'll be a lot of businesses that will suffer in Ireland, a lot. Yeah.
Well, unfortunately, this is going to be felt around the world. But I would imagine if you were already having difficulty with it, it's only going to magnify.
Exactly. Yeah.
What have you learned about yourself during this pandemic?
That I work too hard.
Join the club.
And that, you know, a lot of my life is wasted doing 6 and 7 day weeks, just paying off debt from the recession. And most of it is nonsense from the point of view that, you know, we all will get older one day and say, what was it all about, you know? So I've been lucky from the point of view that I've written 2 books in the last 6 months. Both are going to be published, and I'm halfway through a 3rd book during the recession, you know. I suppose that's the first thing. The second thing is, even though it sounds a bit barmy, there are certain advantages in living in the present and not looking to the future or not even looking to the past, you know. And I know that all these people, you know, talk about mindfulness, and there's the same type of people who sort of believe in everything from green tea to God knows what, you know. But there are advantages in certainly just, you know, because when you're alone with your thoughts, a lot of people have reminiscence about the past, what they should have done, what they don't have time to do, and all the rest. But life is where it's at, you know, and if you just live in the moment, there are certain advantages to that. Unfortunately, that whole mindset has been hijacked by people who, you know, I mean, I visited a lecture recently who we had one of these free thinkers, you know, that was espousing that, but they turned everybody off because at the same time, all the refugees in Rohingya, you know, sort of in Burma, were being fled out of their homes. And some of them had come across to Ireland, and a friend of mine was looking after them. And, you know, one of them had contacted me regarding something. And I was saying to myself, how can you speak mindfulness to somebody who's just had their house burnt down, maybe their family raped? You know what I mean? Mindfulness works for middle-class people who have nothing else to think about, you know? But it works now for everybody in this situation because you're sort of living in the moment. You don't know what the future is going to bring, and you may have regrets about the past. So, I mean, this is the real time that process should be used, you know, not hijacked by people that are running around telling, you know, refugee on the Syrian border, believe in the moment. What moment? This is horrendous. You know what I mean? You know, so.
No, exactly. Yeah. I hear what you're saying. So has this affected your industry much? Are you still treating patients or are you on quarantine? Since you're
Well, I'm in an unusual situation where I had a big clinic in the most expensive part of Dublin before the recession came. And when the recession came, um, my property there dropped to 1/6 of its value. It went from 2.5 million to 350,000 euros, you know? So as a consequence, I sort of changed location, and I do a lot of, I suppose, skin cancers and that type of surgery is a lot of minor surgery as well, along with aesthetic work. But I married myself into one of the top gym systems in the United Kingdom and Ireland, David Lloyd's. And we're so unfortunate because they got closed down, and now we can't get into the building, you know. So I know.
wow.
And I have a patient to go to see tomorrow who unfortunately had a heart valve replacement but wanted me as a doctor. And she's just been moved out of a nursing home where there's 7 patients have got COVID, and she may have it as well. So I'm in a situation now where I can't take her bloods. I don't really have proper PPE equipment here. And the thing is that she's an ex-tuberculous patient, so her lungs are very difficult to listen to anyway, because she's got a lot of scarring. And that's the reality of it, you know. And she's probably infected, you know.
Is she going to be the first COVID positive patient that you will take care of?
Yeah, I don't even know if she's positive yet.
Okay.
But yeah, probably she'd be the first. Yeah, you're right. Yeah, but I know a lot of people who have died, you know.
So sad. I'm so sorry.
They're very all older people who were the mothers and fathers of my patients.
As a practicing doctor, what would you do differently after this? Because we're all going to have to change our lifestyles, like it or not. I think we're going to have a new norm. What will yours be? What will you do differently?
Do you mean in the clinic?
Yes.
Well, before we closed in the clinic anyway, reception was asking the relevant questions, you know, have you been overseas? Do you have a fever? Blah, blah, blah. So now we're obviously going to have responsibility to our staff also. And we don't know the legal implications. If somebody came to your clinic and got the condition, you know, what would happen there? So we're going to have to, number one, probably get rid of the waiting room. Number two, instead of having 6 patients in at the one time, maybe you just have 1 or 2.
Wow.
The third thing is a lot of facial treatments, we're not sure what to do. And a lot of Botox and derma fillers are very close, you know. So we're going to have to obviously use PPE in a big way. Maybe even test people as well. But the autoantibody tests that are quick and easy, unfortunately only tell you if a person had it a few days ago. They don't tell you whether they're asymptomatic and having it now, you know. So then the machines are going to have to be cleaned all the time. And, you know, for ourselves, we're going to have to obviously become even more hygienic than we were. And this is going to last a long time. You know, I mean, it's probably for the next 2 years or more. I think, you know, the quick, easy genetic sequencing vaccines, even though they may kick in pretty fast, yeah, there's a lot of people suspicious that there's a bigger agenda going on.
Yes, I know, the conspiracy theory.
And I don't mean in terms of conspiracy theories. It's very hard to pass comment, you know, because the first thing is people could be watching this that their friends have died. There's 2 or 3 ways of looking at it. If we did nothing, in other words, we used social isolation, didn't do a lockdown, we're not that sure if things would be that much different. That's the first thing. The second thing, we know from the period of the Spanish flu, when they did a big lockdown, you reduce people's immunity to an extent because you're not letting them associate with normal bacterial influences and they're being very clean. And then when you let them out, the second wave happens. Now, if you didn't do a lockdown, the second wave wouldn't tend to happen. And the second wave, of course, with the Spanish flu was much worse than the first one. So you may be flattening the curve, but you also could be pushing the curve just down the road, you know? So we'll know better retrospectively in a year, but there's no doubt about it that a lot of people, particularly the vaccine companies, will have made billions out of it, you know? There's no doubt about that, you know? So, you know, I'm not anti-vax, I'm very pro-vax. I work in the third world, and I spent a lot of my life in Liberia, well, not a lot of my life, but a lot of time, Haiti during the earthquake, there for the cholera epidemic, Malawi, Uganda I'm just back from, you know, I've been there during Ebola in Liberia, you know, so I mean, you would have to take a lot of things with a pinch of salt, let's put it that way, you know, and I'm certainly in no way a conspiracy theorist, but they're talking now that we probably won't even get in until the end of July to our own clinics, and that the hotels in Ireland may not open until September, and they'll have to apply things for the next 2 years. Bars may not be able to open. And I'm just wondering, is it a little bit overkill, you know?
We'll just have to wait and see, won't we? Because I've been doing these interviews now. I've gone around the world and spoken to several physicians who are currently treating COVID patients. And when I asked them, you know, I said, people are wondering if there's overkill on lockdown and closing down businesses. And they've told me, tell those people to come to work with us. So it looks like it varies in different countries, I think.
Sure. I'm well aware of that, and particularly in New York and in Italy, there is certainly a concentration of older people with problems all at the one time. I'm not saying that that doesn't exist. What I'm talking about is something different. Mm-hmm. What I'm talking about is the fact that are we going to keep in lockdown for months and months and months? And at the end of the day, even if we do, will it change that much? Because the first thing is, even with lockdown, all the people in the nursing homes in Ireland, England, and the United States are all getting caught anyway, you know? Yeah. I mean, you could say there isn't enough PPE to protect them, but I mean, if you go and you look at the people who are coming into the hospitals, most of them are quite old. In fact, in Italy, there was a sign up, believe it or not, 70 go this way, over 70 go the other way. Well, it's just because there are other places in the hospital that said it would only take the people below 70, you know? So, no, I don't mean it in the sense of conspiracy theory. And you'll see from my photographs, I've been on the front line myself in terms of COVID. All I'm saying is, that's the hospital, but I'm just talking about the wider population, you know, sort of that we now have our lockdown extended for another 3 months in Ireland, you know, so that nobody's doing anything, you know, I mean, and all I'm saying is, you would wonder, is this totally necessary, you know?
Unfortunately, our time has run out, but like I said, and as long as you're willing, we will organize another time when you have some downtime to do another segment.
No problem. And I don't want your viewers to think for a moment that I'm saying that sort of, you know, that the pathology out there isn't happening. I mean, I've seen it with my own eyes. Of course it's happening. But whether, and believe it or not, I'm not in any way following what Trump is saying, that we should open up America. That's not what I'm saying at all. I'm saying something that's totally different. I'm saying that the number of deaths aren't that much more.
Right.
The answer is always the vaccine, and everybody's waiting to it. Every country in the world is doing the same thing. And just, we should be aware that there isn't a bigger agenda at stake, you know? Right. And if you notice my Facebook posts, and I have 35,000 people, I am very pro-science. I have also a first-class degree in molecular biology, you know, so as well as medicine. So, I don't know, and I'm aware, you know, sort of, and I was aware in Africa during the Ebola time, and one of the first doctors that died in Africa was in Caldwell and Monrovia in Liberia, just outside where we were building our clinic, you know, so, yeah.
Well, I thank you so very much for your time, and I will continue to be in touch with you. I'm just going to pause the camera.
Bye-bye.
Thank you for watching Conversations with Jennylyn, when a conversation is all you need to be inspired. Thank you.